for you and for all the nurses out there, I mean, I can't even imagine that you are working crazy hours, taking care of more patients. They're trying to cut your pay and benefits. So, Sarah, I want to ask you, just to put it in perspective, typically how many patients were assigned to each nurse during the pandemic? And then probably more importantly, put that into perspective. What would normally, in normal times, would you be expected? How many patients at any given time would be under your charge?
On an ICU floor, where patients are the most critically ill, you'd want to have one nurse taking care of one patient, maximum two patients. Nurses have been taking care of 1 to 3 intensive care patients who are extremely sick, or 1 to 4 even. At some points in the pandemic, nurses have taken care of 1 to 6, 1 to 7 patients. And when you're expecting nurses to take care of 1 to 5, 1 to 6 patients who are very sick still, how do you have safe standards? You don't. And these patients do crash, and we've seen it time and time again.
Sarah, there's also a big mental health component. Tell us about that.
Yeah, so I think the mental health aspect of all of this kind of relates to the trauma we have all endured for the last 2 years. When you have to console, family members over the phone, you hold an iPad up so that people can see their loved one pass away in their last moments, and you're the only person there for them because their family members are at risk if they actually come into the hospital to see that patient. So you're not only absorbing the emotional distress of your coworkers, the patients you're caring for, but also the family members who are upset, and rightfully so, that their family member is sick in the hospital and there's no visitation allowed. So you see patients who, need comfort care more frequently than ever before. You might put multiple patients in body bags in a shift. You might perform CPR multiple times in a shift or lead a code. It is trauma after trauma after trauma, and you compound that for 12-hour shifts for 2 years straight. How do you expect this to be okay? That's my question.
Well, it's not a realistic expectation, is it?
No.
Right?
No.